Thank you, Dr. Neha, and thank you, Hindi team. Now we are moving to English session. Today is our 1960th day of continuous webinar. Before beginning the session, we'll have a silent prayer.
डॉक्टर पाटिल आप अपना स्क्रीन अनशेयर कर दीजिए। हाँ जी।
Good evening and welcome once again. Today is our 1960th day of continuous webinar. Today's our guest is Dr.A.K.GUPTA. He is MD in Homeopathy, Homeopathic consultant and gold medalist. He is the founder of AKGS Om Vidya Institute of Homeopathy and Allied Medical Science. National Secretary General, the Homeopathic Medical Association of India, former visiting professor of DR Sir Homeopathic Medical College Hospital, Delhi, ex-guest professor in the College of UK, guest physician of Glasgow Homeopathy Hospital, UK, practicing since 1977, doing special research work in case of motor neuron diseases and author of Childhood Challenges. And he got many awards: Healthcare Excellence Award, Dhanandri Award, Homeopathic Gem Award, Homeopathic Chilsa 7 Award, Homeopathic Gem Award, and presented many papers nationally and internationally, and many I have to say, but I think many of you know him very well. I'm inviting Dr. Gupta on behalf of IFPH to our forum. You're welcome, sir. Please.
Thank you very much, Arnab. And it's really heartening to know that today we are celebrating 1960th webinar, which is a historical thing in its own. And IFPH is really doing a wonderful job. So to start with, I'll need to share my screen.
Yes, sir, you can share the screen now.
Is it there?
Not visible.
Okay, just a minute.
Have you started sharing?
No. Is it there now?
Yeah, started, sir. Yeah, homeopathy has an edge.
It's okay?
Yes, sir. Yes, clear.
Okay. Good morning, good afternoon, good evening, and warm welcome to everyone for today's webinar, 1960th webinar. And today, my topic is the golden ray of hope to MND patients, as homeopathy has an edge in treating this motor neuron diseases, which is a holistic perspective for showing progression and improvement quality of life. Just to know about introduction about the motor neuron disease. It is a progressive neurodegenerative disorder, deterioration of motor neuron in brain and spinal cord. Symptoms, they start from weakness of the muscle, wasting, speech, swallowing, difficulty, respiratory compromise, and conventional medicine largely supportive and no definitive cure. And as we saw in the beginning, the photograph of Stephen Hawking, he had been the longest surviving person with ALS. Am I audible?
Yes, sir. Yes, audible.
We'll be talking about this. The commonest is the ALS, which we see in this America side and the Europe side. But here in India, we normally call it the motor neuron disease, which is the commonest. problem. In these, there are two different types of, cases we see. One is a bulbar, onset, and the other is, motor neuron disease, typical ALS, which starts from the limbs and all that. And the starting symptom could be difficulty in closing, buttoning up your shirt and all that. But today I'll be concentrating only on the bulbar onset and the bulbar MND ALS. The 20 to 30% cases of MND cases are of bulbar onset, which refer to the first signs of MND appearing in the bulbar muscles, which includes mouth, throat, and larynx. Very often we see these patients, they come to us at a very later on stage because initially thinking it to be a throat problem, they keep going to the ENT, different ENT specialists, and one ENT to the second, and then after all, when they don't find any relief, then they've been advised to see some neurologist. And after seeing the neurologist, they come to know that it is, the bulbar onset of the ALS. The symptom could be normally which are difficulty in speaking, that's the dysarthria, swallowing is a dysphagia, and breathing. Prognosis typically has a faster progression compared to other forms of MND. And since I've been doing a lot of research work on this, typically on MND, it's seen more than 1,200 cases now. Each and every patient of MND does not have all the symptoms of classical symptoms of all problems. There are people who have got, bulbar onset, they remain confined to that. But gradually, in few cases, we see that it develops into the, with the affecting with the lower motor neuron and upper motor neuron also. The tongue and speech symptoms in motor neuron disease are caused by the progressive degeneration of motor neuron that controls the muscles of the mouth, tongue, and face. This leads to muscle weakness, stiffness, that we call it as spasticity. It reduces the range of movement and sometimes involuntary twitching. That's what we call it as fasciculation. And these physical changes result in symptoms like slowing down of speech, slurring of speech, or unclear speech, dysarthria, a nasal voice, and difficulty with certain sounds, as well as problem managing saliva and swallowing. Atrophy or thickening of the tongue, increased secretion of saliva. These are the common things which we see in the patients with the bulbar onset. The underlying causes are motor neuron damage, attacks the motor neurons, which are nerve cells that carry signals from the brain to the muscles, muscle weakness and stiffness, which damage the motor neurons and cannot effectively control the muscles used for speech and swallowing. Progressive nature, as the disease progresses, progresses, the muscle weakness and stiffness worsen over time, making speech and swallowing increasingly difficult. If you come to the pathophysiology of bulbar onset of MND, with motor neuron degeneration of motor neurons in the brainstem that control voluntary muscle movements, especially in the throat and vocal cords, impact on bulbar muscle leads to the weakness and atrophy of the muscles involved in speech, swallowing, and breathing. Progression eventually affects other part of the body as the disease spreads. As I said, it is not necessary that all the patients would land up into all type of symptoms. There are a couple of patients who remain confined with the bulbar issues only. The earlier symptoms, slurred or unclear speech due to the muscle weakness in the mouth. Dysphagia is due to lead to choking or aspiration of, which may lead to pneumonia, and that can cause a problem, the respiratory problem. And eventually, when the respiratory muscles get affected, that becomes the more difficult part to treat and cure. And most of the cases, they land up into a fatality because of the respiratory failure. Voice changes, which becomes hoarse, soft, or breathy voice. And there could be people who, speech becomes nasal voice. Drooling, inability to control saliva due to muscle weakness. They have, while eating food, drinking water, or while talking, there is continuous flow of saliva, which comes, from the mouth, and at times it becomes continuous. That person has to be holding something, tissue or a handkerchief all the time to keep clearing this, mouth, because of that salivation, because the patient have weakness in the muscle of the throat also, the saliva neither goes down nor patient is able to throw it out. The symptoms and speech and tongue issues are slurred or slow speech, muscles in the tongue, lips and jaw become weak or stiff, leading to the speech that is difficult to understand. Initially, the patient finds, the speech becomes slow. Person has to make a lot of effort to speak, and sometimes there are certain words which the patient starts finding difficult to pronounce. Nasal voice, incomplete closure of the soft palate can make the voice sound more nasal. Hoarseness or strained voice, vocal cords may become weak, causing a rough or strained sound. As I said, the patient find difficulty in speaking the words like p, b, t, d, k, and g. Struggle to make specific speech sounds, particularly consonants like p, b, t, d, k, and g. Is initially, I've seen in few of the cases, this the speech problem, they say it is just like that. They have got a child in the family, and he speaks in such a manner, so they are just trying to copy, but never realizing that it is a problem. And once they realize it, then it becomes too late and too difficult to treat it out. Speech pause, weakened breathing muscles can cause the voice to become faint and require more frequent pauses for breath, disrupting the speech flow. Tongue problems, the tongue may become reduce the mobility or show involuntary twitching of the tongue also. Like if we ask the patient to protrude the tongue, he is unable to bring the tongue out. It remains like this or maximum this. But when we ask them to, just raise like this, so patient is not able to raise his or her tongue in this manner, and the tongue gets restricted. With a restricted movement, difficulty becomes more when you eat, and the patient is not able to chew because either the food gets stuck on the palate, चिपक जाता है, or because of the non-movement of the tongue, the food is very difficult to take it in, and swallowing further becomes more problem. Speech become tongue problem. The tongue may become weak, have reduced mobility, or show involuntary twitching and fasciculation. The moment you ask we examine the patient, the tongue, there's like this continuous, tremors are there. Now, what to do? Initially, as we say that, the patient has been going to the different kind of a ENT specialist, and sometimes they ask to go in for having a speech therapist consultation and make up, practice of speaking a language. but usually we do not have many patients or who are able to get a proper speech therapist. As we have a limitation of speech therapy, so there is a problem that we do not get the expert, help from the therapist for the patients. And these patients, they are those who are staying in a far-flung areas, remote areas. So there is a very, very big issue which I am facing with my patients. They do not get either speech therapist is very difficult to get, and not even the physiotherapists are also not available. So once this problem is already a degenerative disease, progressive disease, and having a very limited course of treatment, and we need to treat them with medication and supportive therapies like it as a speech therapy and physiotherapy and psychotherapy also in certain cases. Because but the paucity of those two, what we call as an accessory measure, patients are not able to get a desirable result, which they could get had they been assisted with these kind of therapies. Speech and language therapists can provide strategies and communication aids to help manage speech and communication difficulties. Consider communication aids. As the condition progresses, communication aids can become essential to maintain effective communication. And motor neuron disease, National Institute of Neurological Disorders, they've been doing this. Now, diagnosis of bulbar, as you all know that, MND or motor neuron disease is one particular disease where there is no one particular test which can identify or which can completely diagnose this particular disease. It may have symptoms may mimic with many other problems, but there is no one single test or single diagnostic tool which can say that this is a confirmatory diagnosis of motor neuron disease. The confirmation of diagnosis comes when we see the patient having these problems with progression. Progression is the main key feature of diagnosis for this particular problem of motor neuron disease. Clinical examination, identification of symptoms like difficulty in speaking, swallowing, and breathing. And EMG is to assess the electrical activity in muscles and confirms motor neuron damage. And in quite a good number of cases, we have seen this EMG or NCV, they show, anterior and horn cell disease, they've been giving this indication out there and having a problem. But when we get these tests, so they just give us an idea of this. But if we see the progression is there, continuously the symptoms are progressing and they are, going from bad to worse and increasing on other things, that confirms our diagnosis for the motor neuron disease with bulbar onset. To rule out other causes of symptoms, we can get the MRI done or the genetic testing. If family history suggests a genetic form of MND, and I have one family where I have got 7 patients in the same family suffering from motor neuron disease, which is one of the very, very rare. It's only one instance who have, I have 7 patients in one family, and there was another case, there were 2 persons suffering from the MND disease in the same family. So this is not a very common feature, but yes, in rare cases it has been seen. And when we get the genetic test done, you see the SODs and all that, but that again becomes difficult for the investigation part, which is not available everywhere. As I said, the symptoms, they may mimic other diseases also. The other causes of bulbar symptoms they show can be stroke, multiple sclerosis, myasthenia gravis, and GB syndrome. There are certain symptoms which may mimic of this MND as well as these kind of a disease, for which we need to do a DD, differential diagnosis, by again going with the history and symptomatology plus the progression. Progression of bulbar onset of MND. Early stage, difficulty with speech and swallowing, but the person may still be able to walk and perform daily tasks. Middle stage, more pronounced weakness in speech and swallowing, possible impact on breathing. And late stage, complete loss of speech, swallowing, and independent breathing. Use of assistive devices, ventilator, feeding tube may be required. So this becomes the, complication of this particular problem when it becomes into a later stage. And whenever these symptoms they come, the patient start having yawning symptoms. There are people, patients who start complaining of yawning, uncontrollable yawning is there. So then we can see that the progression of the disease is there, and the patient is going in a more problematic stage. Speech therapy helps with communication strategies and maintaining speech as long as possible. Swallowing therapy techniques to improve the swallowing and reduce risk of aspiration. Nutrition, dietary modification, and use of feeding tubes for patients with swallowing difficulties. Breathing support, use of non-invasive ventilation, that's, for example, is BiPAP, to help with breathing problems. These are the aids, these are the things which may be required, and we may have to see the patient. They need, a rice tube, or they may need BiPAP, or these type of things are required as considering to their condition and situation. Now, still the patient is better off. And at the moment also you can understand things, speech is not as clear as it should have been. So you can imagine what would be the condition prior to that when we started the treatment. Now she's saying she's better off now.
पहले मैं कहूँगा जो है साफ आवाज नहीं निकलती थी मेरी, अभी कुछ आराम है, मतलब कुछ साफ समझ में तो सुन के आता है। खाते हुए तो सटक में भी करने जो फर्क था, आता मतलब जो अंदर बोलते और कहूँगा।
These are all, patients with a bulbar onset. कैसे कैसे किस किस चीज में इम्प्रूवमेंट है? वेरी गुड. अभी वो शरीर में फर्क किस किस चीज में हो रहा है? About his tongue symptoms, what is like that? What improvement is he feeling in the tongue symptoms? What there before? तो नोट ओवरऑल कैसा महसूस कर रही है? What is overall? Now, as far as this, I mean, conventional approach towards ALS and MNDs, what they say, there is no treatment and hope. If you, when the patient comes to me, he has been to different kind of hospitals and neurologists and seen the internet where it has been everywhere it has been written that there is no treatment for MND, there is no treatment available for MND, ALS, and unfortunately, these neurologists they start telling अभी तो ये प्रॉब्लम है कल को धीरे धीरे आई मीन ग्रेजुअली इट विल इंक्रीज लाइक आई मीन द प्रॉब्लम विल इंक्रीज विद इन कपल ऑफ मंथ्स you will be on bed and after that I mean this thing will happen you will be completely paralyzed you will be I mean just like a vegetative state and तो इसलिए इसको आराम से घर ले जाओ take it the patient at home. Now this I have recently I saw a patient who was brought to me from Nepal. He came to India, went to the Medanta hospital on his foot, walking in a properly, and once he was there in Medanta, he was put into the ICU for 3 days, and then ventilator. Then after he was kept on ICU for more than a month, and then he was discharged, and then said, "Okay, I mean now you go. I mean nothing can be done about it." Now this is the state of affair when they go to modern medicine people and they say that there is no treatment available. I would rather say this has been a very pathetic situation. The patient who goes in a normal condition as of a proper case, and he's been told like this, you have got a limited period of time. So he and his family members, they get such a big shock of their life and they start dying. The patients start dying right from the day one every day because he has been told in given that kind of a picture. So which I have been trying to persuade this something from medical community that they should not speak in such a manner because doctors' word are very important. And doctors, instead of giving a hope, you are just telling a patient there's nothing possible, nothing is available in the world. So the patient gets completely disheartened and broken. So his faith is shattered. And once they start trying, some alternative therapies like homeopathy and all that, here patients, they feel better, but still that thing which has been honking in their mind, that ultimately there is no treatment. So that causes a big problem to understand and realize that the effect of medication is there and they find difficult to say so. But not all cases. So this is where we need to say, and that is why I've said this, there is a edge, homeopathy has got an edge Now, why we have got an edge? That's what we'll discover, because homeopathy is in modern medicine, what they are doing, every patient of them, if they give them one same medication, one is Riluzole or Relator, or at the most they are going in for Adawan injections. Each and every patient is given the same prescription. Now, this is a one big issue, that they've been giving same medication to every patient, and whereas when he comes to us, we take up the complete case history and try to find out the cause and all that. And what in my research work I have seen, all these patients suffering from motor neuron disease, they are very sensitive in nature, and they have had some kind of in the past experiences, some injustice in their life, or they have been the victim of certain insults and all that. So they have been harboring those things, and ultimately resulting into this. And these patients are quietly, principals person, highly qualified also. Like we have patients from the defense forces, we have patients from the institution, professors, principals, vice chancellors, and academicians, and so much so even the army. Like we have got a patient who's been commandos. They have undergone certain situation in their life, which has led to this kind of problem, and they've been responding to the homeopathic medicine because we have been treating them according to their symptoms of the patient, not the symptoms of the disease, as which we have been talking about before. And that is the only one reason, that since we have been treating the patient on totality and constitution, they are able to give us a good result. MND is a fast progressing degenerative disease, devastating illness which leads to progressive paralysis and eventual death. It is considered to be an incurable disease where modern medical science does not have much to offer. No treatment or hope left for patients, usually told by the neurologists and hospitals. It completely breaks the morale of the patient and her family members. Such statement on the part of the doctor initiates a vicious cycle of shock, anxiety, despair, hopelessness, depression with the patient and her family members, tearing down the fast approaching unacceptable death. This is a very, very important part which we need to see. By the time the patient and her family members consult another professional or a second opinion, the doctor's words, there is no treatment, have almost hijacked the patient's belief system and caused significant damage, which becomes a major hurdle in responding to any form of subsequent treatment and recovery. Encouraging results have been obtained with homeopathy, as patients are highly principled and oversensitive in their demeanor. Any injustice, deceit, or grief has been traumatic to their constitution, which led to the development of motor neuron disease. Homeopathy being the only science. Sorry. Sorry, homeopathy being the only science that weighs the importance of mental symptoms equally to physical symptoms, thus scores all over other medical systems in the treatment of motor neuron disease. This is the most important part, and I sincerely thank to Dr. Henneman for giving us such a beautiful system of medicine to treat the patients. Now, limitation of conventional management. Drugs like, as I said, Adawan or Riluzole, modest flowing, no reversal with side effects as of nausea, loss of appetite, and affecting liver. Symptomatic relief only with physiotherapy and supportive care. Stem cell therapy is being nowadays used, by the people because of the financial problem issues. because it's a pretty expensive, treatment. And I have patients, those who have got at least 4 to 6 cycles of stem cells also with no result. So this is not, giving any good hope, but people say that this is the latest, as the research is going on, stem cell is a very, incoming things. So everyone keeps trying. It is very expensive with no reported benefits to the patient. High economic burden and emotional stress. Homeopathic approach, individualized and holistic approach, stimulates body's self-healing, addresses physical, mental, and emotional state. It is safe, gentle, non-toxic, long-term use, can complement conventional therapies. Miasmatically, when we talk about homeopathy, this MND is a combination of all chronic miasm, psora, psychosis, and syphilis. Psora, syphilis, and psychosis predominantly falls into the syphilitic miasm, though the constitutional simillimum is the dictum, but as MND is a fast progressing degenerative disease, remedies with regional affinity become equally important. Here would like to be excused that I have been using, despite of the constitutional treatment and all that, I have been finding the need and necessity to use some more medication at the same time for the relief of the patient, rather than just sticking on one single medicine and a single dose and carry on. I have been very open in accepting it, because this is what I'm saying. I'm just what I do. I tell that a system of medicine is not defined by its tools, but by the principles and intention behind using them. Homeopathic edge in MND. Holistic individualization slows the progression, it improves the quality of life, mobility, speech, and swallowing, and addresses psychological impact and remains non-invasive. Case studies, improved mobility, speech, as we saw in few of the videos of the patients earlier. Swallowing, reduced frequency of spasm, research, neuroprotective and immunomodulatory potential, works synergetically with physiotherapy. And this is another case. Anxiety और घबराहट जो था बहुत ज्यादा, वेरी गुड, एंजाइटी बिल्कुल ठीक है, चलो गुड। अच्छा, अब आपको जब कमर कुछ आगे कितने झुकता था, अब नहीं झुक रहे, अब नहीं गिर गिरने का जो डर था ना, वो अब नहीं। वेरी गुड, ठीक है, लेकिन चलने में दिक्कत है, थोड़ी गर्म पानी काफी कम हो गए, ठसका वो 80% मतलब खत्म हो गया, 60% चौकी खत्म हो गई, वेरी गुड। हाथों में थोड़ी वो मसल्स आने लगी, गुड, पहले एकदम पतले थे, अभी पिछले महीने से नींद भी थोड़ी ठीक आती है, वेरी गुड।
ਪਹਿਲਾਂ ਨਾਲੋਂ ਠੀਕ ਆ ਜੀ।
किस चीज फर्क पे?
ਇੱਕ ਤਾਂ ਚੱਲਣ ਚ ਠੀਕ ਆ, ਪਹਿਲਾਂ ਨਾਲੋਂ ਵਧੀਆ।
डिगे तो नहीं?
ਨਹੀਂ ਡਿੱਗੇ ਡੁੱਗੇ
ਉਹ ਜਿਹੜਾ ਪਹਿਲਾਂ ਉਹ ਮਤਲਬ ਇੰਬੈਲੈਂਸ ਹੁੰਦਾ ਸੀ,
ਨਹੀਂ
ਉਹ ਵੀ ਨਹੀਂ ਹੁੰਦਾ। ਵੈਰੀ ਗੁੱਡ। weight gain
ਹੋਇਆ ਜੀ,
ਕਿੰਨਾ?
4-5 ਕਿਲੋ ਹੋਇਆ।
4-5 ਕਿਲੋ। ਪਹਿਲਾਂ ਤਾਂ weight ਘਟਦਾ ਪਿਆ ਸੀ।
ਪਹਿਲਾਂ ਘਟਦਾ ਪਿਆ।
ਅੱਛਾ, ਹੁਣ ਕੋਈ ਮਸਲ ਲਾਸ ਤੇ ਨਹੀਂ ਕਿਤੇ?
ਨਹੀਂ ਮਸਲ ਥੋੜਾ ਹੈ ਸਰ।
ਕਿੱਥੇ?
यहाँ पर है थोड़ा।
अच्छा, हाथ चुक के दिखाओ, दूसरा कोई दर्द नहीं, खिंचते नहीं पैर कितने? अच्छा कोई वीकनेस वगैरह नहीं महसूस नहीं?
स्लीपनेस भी कम है, पे नाइट फॉल भी तो
स्टिफनेस भी घट है?
नाइट फॉल भी था।
अच्छा नींद ठीक है?
नींद
हाँ नहीं अनामिक दोबारा, हाँ दोबारा बताइए क्या 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 वो कैसे पहले से कैसे हैं?
वेट गेन हुआ है 1.5 किलो।
1.5 किलो वेट गेन हुआ है, वेरी गुड। अच्छा और
हाँ, और कमजोरी भी कम हुआ है।
कमजोर भी कम भी, बहुत अच्छी बात।
थोड़ा ठीक है।
ठीक है। और जो एंजाइटी घबराहट वगैरह थी वो कैसी है?
वो भी थोड़ा कम है।
वो भी कम है, वेरी नाइस। और वो जो नेगेटिव थॉट्स आ रहे थे
वो भी कम है थोड़ा।
वो भी? Now see, in all these patients, they do suffer from the same disease, but they have been treated by different remedies. Like this patient got a causticum, lachesis, and this person, the early patient was with the ignitia.
ना ठीक है जी।
Remedies often indicated are causticum, which you see there's a paralysis, progressive weakness. Plumbum metallicum is a one medicine which has been used very frequently in these cases with muscle wasting, spastic paralysis, and fasciculation. Zincum metallicum, twitching, nervous exhaustion, especially in the lower limbs. Cuprum met, spasms, cramps, and I've seen the patients with a bulbar onset, they get cough spells the moment they drink water. They won't get a, cough after taking anything else, but especially after the water. Cupromet has shown a very good result in that. Arsenic album with the anxiety, weakness, and burning pains. And as I said, selection depends on the individual case. Now, coming to the speech part, now this is the one important thing in homeopathy that we are in our Medica and repertory. We have been able to get very selective symptoms with that some particular remedies. When we have got a speech therapy, mouth speech, see in the mouth, speech broken, you got a camphor, defective speech, and then a nux mosquita, and then these particular remedies are given there in our repertory. Then referring back to the Medica and finding out the totality, it becomes easier for us to treat the patient with those medicines additional to the constitutional treatment. As I said that, I'm not in each and every case that only one remedy has been given. I've been using these supportive medicines also as per the particular symptoms of that patient. Now you see that with the larynx and trachea voice lost temporarily is, then you have a tuberculinum. If we see there is a tubercular diathesis, there is another, symptoms of tuberculinum comes there, we definitely would like to give that. Other than that, constitutional medicine, and it shows very good results. In synthesis repertory also, every repertory is there, but we need to consult, these repertories as and when required. And then according to the repertorization and all that, I had been doing this, that taking out the constitutional treatment part once with the, overall repertorization, especially with the mental side, and these local symptoms, physical symptoms, also I repertorize separately, and then it is being given continuously in a lower potency remedy, which has been helping. Homeopathy's role in MND care plan: early stage, slow progression, better energy, moderate, maintain independence in daily activities, advanced stage, palliative support, reduce suffering, works with physiotherapy, speech therapy, and nutrition and counseling. This is what I tell my patients, that we need 4 components. The compliance of the treatment is a homeopathic medicine is to be there regularly. Then physiotherapy or speech therapy, whatever is required, physio and speech therapy. Then diet part and psychotherapy. Psychotherapy is counseling, because the patient has got so much of negativity in him or her, there is fear of death is pronounced all the time. I've been having patients, those who were given a specific period of time that you may not survive more than this 1.5 year or two. The patient is still alive with me, and it's been 16 years now. It's not only one case, there are quite a good number of cases, though patients have overlived their times given by their neurologist. And that is thanks to homeopathy and thanks to their belief in our system of medicine. Patient-centric benefit, it's a safe, cost-effective, sustainable for long term, provides hope and coping ability, enhances dignity of life. If we see that, this graph, survival time after the first diagnosis of MND was this, and in this particular cases with homeopathy, it has with intervention, it has increased to a greater extent. Homeopathy offers unique advantages over conventional medicine. One is symptomatic relief. It slows the progression, arresting the progression, enhancing the quality of life, even complete reversal seen in few cases. Integration with multidisciplinary care ensures better outcome and hope. Over the period of 16 years of treating more than 1,000 patients of MND, I have observed that most of these patients are highly principled and oversensitive in their demeanor, and any injustice, deceit, or grief has been traumatic to their constitution, which is led to the development of MND. Homeopathy being the only science that weighs the importance of mental symptoms equally to physical symptoms, thus scores overall other medical systems in the treatment of motor neuron disease. Now, this you can see this was in 2019. The patient was brought on the lap of a father. He's unable to get up, and you can see the wasting of muscles over here. And a young chap. And in October 23.
अपनी किसी भी मेहनत को बेकार मत मानना। अपनी किसी भी मेहनत को बेकार मत मानना। मंजिल तुम्हें जरूर मिलेगी, बस हार मत मानना।
And now this patient is preparing to join the Indian Defense Forces, where he was completely handicapped. He was been not able to get up from the sitting or lying position. Now he's been doing push-ups and running and planning to join this Indian Army. Battle against MND has been won with homeopathy as the main weapon. Though not claiming definite cure, homeopathy has provided respite to many patients in their persistent and progressive suffering from this dreadful disease and gives golden ray of hope. Let us put our best efforts to put an END end to MND. Thank you very much. Thank you very much. Thanks a lot.
Thank you so much, Dr. A.K. Gupta. Your motor neuron diseases, really wonderful cases, miraculous cure you have shown here. And it's very wonderful that you are treating such cases. It's an inspiration for everyone. Thank you so much for presenting and sharing your knowledge here. As you said, different medicine are giving such cure here. Anyway, the participants, if you have any question, means please ask to doctor. Please raise your hands and ask questions.
Any question?
No one is asking anything.
Hello,
Uh,
hello, sir.
Okay, Dr. Hariharan, you can ask, please.
Hello, sir. Very good, very good. Your cases are very nice and keyword very wonderful. And see, I want to know, sir, the potency selection. Which potency you are giving?
Well. I mean, it's an important question, and as I said that I mean, in especially treating these type of cases, I'm not very conventional in going that. I go according to the need of the patient, and if I get the very definite cause, as I said, like I mean, when taking a deep history, there've been cases like I mean, I can tell you the patient who was to be promoted got the promotion due, and he did not get his promotion one after the another, 2, 3 occasions. And then he never discussed this thing to anyone else, but he kept in his mind. There, we had given medication with a 1M potency, started with 1M potency like stephysagria and all that. There's a case which I get a definite one, I start with 1M. Or like in this particular young boy's case, the case which I saw, which was shown last, I started with arnica 10M because it's a long case to be, can't be discussed over here in complete this way. But I started with arnica 10M with that kind of a history of fall and injury. After that, things have started. So, and the other local medicines, like for local problems, I've been using 30 or 6. In few cases, I mean, I've seen the patient, those who have got, toxicity of metal like lead. The lead level have been high, mercury level have been high. There I've been trying to give medication with, very low potency, like plumber met has been giving 6. So there we have been getting a good results. But LM potency I have not been able to use in these cases because these are the patients, they come from far off distances, and giving the medication and asking them to do it in this particular formation, they find it difficult to take, and swallowing is the one very big problem with them. So all of them are not able to, take that kind of a medication. But
Okay, thank you, sir. Thank you, sir.
thank you very much. Thank you.
Thank you so much, sir. Thank you, Dr. Hariharan. Anyone else? And here you have some suggestion like, thanks, please, Hindi session plan earlier with treatment advice, also advice with nutrition advice.
Sorry, please.
I think you can see the this one in the chat box. Many suggestions are there. Dr. Dhanrajnika. If you want to ask questions, you can directly ask Dr. Dhanraj.
Yes, you can.
Dr. Dhanraj, you were actually sent 2, 3 messages. If you want to talk, you can come forward.
No,
please.
you want to speak in Hindi or you want?
Yeah, you can speak in Hindi also.
Yes, no problem. I mean, you can ask him.
He was asking you to take Hindi classes. Anyway, I think he's not ready to ask questions. Anyway, Dr. Danesh.
Well, I mean, this is one question. I mean, thing is there. Let me read out. So, like state government.
Dr.
Yes, sir.
Well, yes,
Yes, sir. It's really
it is
really an excellent session, sir. It was really an excellent session. You really show the beauty of homeopathy, why the physical symptom and mental symptoms need to be looked into, and how it can be used for treating the patient, and how one can differentiate the patient, a patient from the other patient with the same disease,
Yeah.
and then how can we manage all these things were beautifully described. And doctors, not only the juniors but also the seniors, how to practice homeopathy and how much of belief one need to be in our system, and how one can take the repertory and materia medica in treating the patient. And you mentioned about while treating the constitutional treatment to the patient, at the meantime, in case of if it is needed, then you can refer, you can take medicine according to the symptoms demand. What's your opinion? So in medical cases, whether you advise the patient medicine, and just like, for example, by treating a chronic cancer case, if the patient's condition.
Dr. Danesh, your audio is not clear.
Not getting a voice.
Yeah, Dr. Danesh, there
No,
is.
but there's one thing somebody has asked about the government. Since it is a serious disease, why, I mean, then treatment is not being started by the government. Well, I must tell you that we've been trying to include this in the disability and all that, and the efforts are being made. In foreign countries, they have got, I mean, they got groups, like the ALS groups and all that. They've been getting uh, subsidies and a lot of help from the government. But here in India, it has not been started as yet, but we've been trying to, I mean, make a kind of a community, MND or ALS community, so they can work forward and look forward to this. And since we are doing this research work, I would definitely be very keen if any organization joins us for this particular thing.
Thank you so much, Doctor. Now we are moving to the next session. Thank you so much for
Okay,
your
thank you.
wonderful
Thank you very
classes.
much. Thank
Really,
you.
really, this is the miraculous cure of homeopathy. Thank you so much. And come
Thank you.
again with more
Yeah,
knowledge. Thank you.
Thank you very much. Thanks.
And thank you all the participants who joined here. Now I am handing over the session to Dr. Manoj. You are welcome, Dr. Manoj.